Hope Channel viewers are loyal, encouraging friends and neighbors to watch. Why? Our viewers believe that Hope Channel not only enhances living, but changes lives through its compelling lineup of programs. Documentaries take subscribers around the world and back through time, visiting places where history was made. Fascinating biographies open up the lives and times of people who made a difference. Travel programs transport the viewer around the world, demonstrating how people work together to make a better planet. Inspirational programming challenges viewers to experience the joy of discovering faith values and offers spirituality as an important part of a balanced lifestyle. Health and lifestyle programs teach disease prevention and make healthy living simple and attractive. Hope Channel programs provide invaluable support for developing healthy relationships and strong communities. Welcome to donor-supported Hope Channel.
According to the World Health Organization, globally in 2013, approximately 9 million people were actually affected with tuberculosis. And of this, 1.5 million were considered to have died of the disease. And of the 1.5 million, approximately 500,000 were women and 80,000 were children. So you can just imagine how terrible this disease is. And Dynamic Living, the Total You, would like to invite you, dear viewers, in the next 60 minutes to be with us here in Hope Channel as we discuss dealing with the mutant TB terrible. So I'd like to welcome to the show my guests. I have here Dr. Evelyn Magsayo. She is the Program Coordinator, Infectious Diseases Cluster, Department of Health, Region 10. Good evening sa iyo, Lynn.
Good evening, Dr. We are very glad that you invited us again. I think this is the third time.
Huwag mo nang bilangin.
And now it's our opportunity to spread probably good news with regards to TB control in our country.
So good news tayo ngayon,
It's
ha?
good news because we're about to celebrate, in fact, the World TB Day on March 24.
Yes, so inunahan na natin dito sa Dynamic Living ang celebration na yan. And of course, we have also Miss Jennifer Garcia. She's the Senior Health Program Officer at the Department of Health, so sa DOTS na program. We'd like to welcome you to the show, Miss Jen.
Thank you, Doc. We are very happy that we are here tonight, Doc, to guest your show.
Okay, so let's start off. Kanina binanggit ko na globally in 2013, 9 million daw ang affected na mga tao with TB itself. Would you say, Dr. Evelyn, na hetong data na to kasama na ang taga-Pilipinas nito?
Yes, apil na. Kasama na yan. We are part of it. In fact, we belong the top 22 high-burden countries in the world. And we rank number 3. 9 in the world. So in the Western Pacific region, we rank number 3.
When you say na 9th and then 3, heto ba among the top na merong number of cases?
Highest number of reported TB cases.
So it can go both ways. Pag sinabi mo na mataas yung ating reported cases, it can mean two things. Magaling tayong maghanap at mag-report o pumupunta talaga yung mga pasyente sa atin o kaya naman possibly na hindi natin nakokontrol yung problem. So, yes.
Yes, that's true. Because the earlier or the more number of cases that we find in terms of estimated number of TB cases, in fact, the current estimated TB cases in our country is 265 per 100,000 population, and probably next year, this year, we are looking for about 292 now. We increased per 100,000 population.
Marami yan, Lynn, ha?
Yes, that
Pag
is in
sinabi mong
100,000.
Yeah, pag sinabi mong 262 cases out of 100,000,
Yes.
you multiply that by how many millions Filipinos we are,
Yes.
then we get that more or less approximate data.
280 or something like that,
Oh,
280,000.
malaki yun.
Yes.
And then you're saying also na, pero this year, parang tumaas pa yung number.
Yes. Yes, because there is still a large number or a certain percentage, more than 25% or 30% that we still miss. We are missing cases, so we want to find them according to our estimates. And then, but with regards to, as I've said, we are going to celebrate the World TB Day. It's a celebration. It's no longer a commemoration, because the Philippines is one of the 5 countries among the high burden 22 countries that were able to reach the target MDGs, which is reducing incidents. In fact, there is about 13% per year reduction of
So mataas.
yes, TB cases annually. And then we also reached the target of almost having the mortality rate, from 50 to from 48, something like that, to 24.
Which is a huge leap,
Yes,
no?
yes,
So,
it's a huge leap.
Yeah, di ba, Jen? In other words, pag sinabi ni Doktora dito na dumadami and yet nare-reduce natin at lumiliit yung mga namamatay, it speaks something of how far the government is doing its job in trying to educate people about TB.
Yes. The focus now is not just empowering our local government units, our respective rural health units in the municipalities, Doc, but also we are catching up. We are engaging, actually, we have already engaged the hospitals. All public hospitals in Region 10 in particular are already engaged in our Hospital Dots initiative. And for this year, with the help of our NGO partners, the Philippine Coalition Against Tuberculosis, or the PhilCat, we are to engage the rest of the 40 private hospitals.
So in other words, heto para bang magkakasama na ngayon, private and government sectors. Pero ang ikinaganda dito sa programs ninyo, parang it's in the grassroots level.
Yes.
Kasi sinabi mo kanina na municipal health offices, the rural health units, in other words, they are now empowered, they are taught how to read the slides, how to be able to report them, how to find the cases.
Yes. Even our barangay health workers and our CHT navigators are already oriented with our revised NTP Manual of Procedures, Doc.
So, yun yung siguro, that will account kung bakit bumaba tayo. Hindi na tayo masyadong mataas yung ano natin doon.
Yes.
I mean, maybe the numbers would speak for itself na mataas pa because of the case findings, no?
Yes.
So, ibig sabihin, masigasig yung mga tao natin maghanap.
Yes.
So, now, puntahan natin. Let's backtrack a little bit kasi our viewers, okay, dear viewers, please, we have our phone numbers there in the TV monitors that you have. If you have questions, please feel free to call these numbers, no? So you can interact with us, with our guests. Now, balikan muna natin, what's so important with TB? Kasi kung ako nanonood ako, TB, telebisyon. Hindi naman telebisyon, kundi tuberculosis, di po ba? So ano ba ito talaga, Dr. Evelyn?
Because ang TB is really still a public health, top public health concern, no? Globally and even in the Philippines, because TB is an infectious disease. It is transmitted airborne. So, and one TB case, active TB case, can infect 10 to 15 persons per...
So, balik,
Yes.
So, sundan ko yung
Highly
sinasabi mo, kung ako ngayon, may sakit ako niyan, at active yung disease ko, in other words, I'm contagious kasi hindi pa ako nagagamot, di po ba? So, ibig sabihin, you know, the mere fact na I breathe in and out,
Every second.
di ba? Every second of it, then merong mga tao sa palibot ko, na mga 10 o 15 katao, pwede ko silang mabigyan ng basilay, di po ba? So that's the menace there. And yet, hetong sinasabi nating TB na ito, sino ang pinaka-prone na magkasakit nito? Like for example, heto bang mga mas bata, mas matanda, mas adult, may mga sakit? Sino sa kanila ang at risk talaga?
Yes. So anybody can be infected with the TB bacilli. But the most at risk are, we call them the vulnerable population, the very young and the elderly, the very old. This because we consider them immunocompromised, or those people with high clinical risk. That means that they have immunocompromised diseases like cancer, like diabetes is also a high clinical risk. Those are some examples. And then those taking anti-inflammatories or steroidal medications. Then we also have another vulnerable population. We call them the high population risk. No? These are the people in the jails, in the GIDA, we call them geographically isolated and disadvantaged
Ano to?
people.
Ano itong JEDA na to?
GIDA, those people living in GIDA, Doc, yun yung ating mga indigenous people, Doc. Mga IPs natin. Sila basically kasi, hindi kasi sila naaabot or mahirap silang abutin ng ating medical services. That's why they are part of those vulnerable population.
What about mga health workers? Do you think na kagaya sa inyo who are so exposed with this, aren't you afraid that you would also be high? I mean, you would have a risk greater than the rest of the population?
Yes, yes, that's true. That's true. In fact, we have this in the program. One of the initiatives of the TB program is to incorporate or integrate the TB infection control in the health facilities.
Which actually we will discuss mamaya, no? Pero andi dito pa tayo. Heto ngayon hetong mga risk populations na to. Paano, 'di ba, nung araw ang tinuro sa atin sa mga libro natin pag marami kayo sa isang bahay, pag maliit masyado yung isang kwarto, if you live in a one-shack place and there are 10 of you, ang probability of it spreading further, even sa nursing homes, di ba,
Yes,
Jen?
yes, yes.
So, napakataas. So, part ba yan sa inyong ini-inform or ini-educate ninyo sa mga tao when you go into information dissemination?
Yes po. For instance, kung may isa sa family, let's say for instance ang papa, nagkaroon siya ng TB, nagkaroon siya ng active TB, magkakaroon tayo ngayon ng contact tracing, especially within the immediate family, kasi yun yung palagi niyang nai-interact.
And pag sinabi mong contact tracing nito, you mean na pati sila isasali sila sa gamutan?
Yes, because we consider them also as vulnerable population. In fact, the current manual of procedures is that we already reduced in terms of who are those. We are now going to the symptoms of TB. We call them now as presumptive TB. And for people belonging to the vulnerable population, including the contacts of TB patients, we do not wait for 2 weeks, at least 2 weeks of cough. The criteria now for a presumptive TB for the vulnerable population is cough of whatever duration na.
So kahit na isang linggo lang. Kasi di ba sabi natin dati na pagka ang ubo mo ay lumagpas ng 2 linggo, kailangan magpakonsulta at baka naman ito ay tuberculosis, di po ba? So ngayon, you're trying to tell our viewers and educating our viewers na any cough for that matter, kahit na 3 days or 4 days, basta sigurado kang na may kasama ka na may active tuberculosis, ikaw kasama ka na dapat sa gagamutin. So, heto, we're talking about the active. Paano yung latent? Kasi 2 klase yan Yung latent, yung sinasabi natin, natutulog lang sa katawan natin. Would you like to answer that, Jen?
Sa mga latent, sa TB in children naman kasi, like for instance, Doc, gusto ko lang i-ano yung kanina mo. Hindi naman siya agad gagamutin. Iti-trace pa siya, i-check pa kung nagkaroon ba siya talaga din ng active TB. If so, dun siya iti-treat. Oo, kasi kunwari kapag, especially for vulnerable population like the children, meron naman tayong tinatawag na isoniazid preventive therapy.
So now you are going into, meron palang prevention. Kasi nung araw, hindi tayo nagbibigay niyan to prevent, di ba? Parang we wait for the symptoms to come out or for the diagnostics to become positive. So ngayon, sa mga kabataan, anong ginagawa natin?
Yan yung ang tinatawag natin dito ay isoniazid preventive therapy, Doc. Oo. Ang nangyayari dito, kapag ang bata ay positive siya sa tinatawag natin PPD or yung Manto test. Kasi nga na contact trace siya, pero wala naman siya nung symptoms talaga nung TB, ina-undergo siya ng IPT or isoniazid.
How long does the medication for this child go?
Nagtitaper siya, Doc.
Aha.
Oo, nagtitaper
So,
siya.
isoniazid lang. Wala nang ibang ibibigay sa kanya. Yun lang.
Isoniazid lang po.
Pero itong mga pediatrics na to, kasi nag-PPPD talaga tayo, ang mga pediatrician natin.
Yes,
So, once na mag-positive yun, kailangan dalhin para mabigyan ng gamot.
Yes.
Paano yung mga negative? So, walang problema. You don't give them any treatment. Despite the fact na kasama siya doon sa area na may positive.
Okay. First is, there is a criteria, no? Criteria for children. We give latent, for the program, the NTP, we give isoniazid preventive therapy for children below 5 years old.
Yes.
So
Okay.
under 5, 0 to 4 years old. So, and then, the other, for the adults, it's only those people living with HIV.
Yes.
Ah,
So,
PLHIV.
PLHIV.
So, people
Yes.
living with HIV for adults,
Yes.
pagka bibigyan
give-
talaga sila ng
give.
isoniazid.
Yes.
Automatic yun.
Automatic if TB is ruled out.
Aha, yun yung natin.
Yes,
So heto ngayon, let's talk now. So heto latent, heto active. Pag active tayo, what are the usual manifestations? Kasi syempre, yung mga nanonood sa atin, sabihin sa atin na ubo lang ba ang kailangan ko para ako ay pumunta sa health center o kaya naman sa munisipyo or sa rural health units para magpa-examine.
Yeah. So, ang tinatawag natin is presumptive.
Okay.
First is presumptive
Yes,
TB. So, yun ang sinabi namin is cough of whatever duration if it is, if that person belongs to the vulnerable group, the three. No?
Yung
The
binention mo
contacts,
kanina,
the high risk, the clinical risk group, and the high population risk group. Then, otherwise, they have, the other population would be, the rest of the population would be cough of 2 weeks or more. And then they should be, all of them should be tested for, we call that DSSM, direct sputum smear microscopy. That's still our main diagnostic tool up to this present. But
That is for the presumptive.
that is for the presumptive.
Uh-huh.
So for those do not have the symptoms of TB, so there would be another criteria for that.
Pero
So,
kasi, Line, in actual practice among doctors, di ba, when we tell our patients, we always ask them, aside from cough, di ba sometimes they also tell us na pumapayat, walang ganang kumain, parang, and usually yung fever. Is it still true? Na-encounter niyo pa ba to when you interview them na yung parang sa textbook sinasabi natin na parang, oops, para kang may sinat pagkahapon na.
Yes.
Parang kasi there's this specific sa kanya na parang yung lagnat mo is more of towards the afternoon and evening, not during daytime. Tapos parang matamlay ka, parang madali kang mapagod. Is it still true today?
yes, but we most common symptoms of TB in adult is cough. 85% or more, because majority are pulmonary TB. So if they do not have the pulmonary TB, it could be extrapulmonary TB, the remaining 15%. So that's where we base the fever, the weight loss, so
Anorexia, dun yan, Oo.
other constitutional signs and
Pero,
symptoms.
yeah,
But for children, we have this criteria for presumptive TB in children.
And these are?
There are 7 symptoms, Jen, no? Then there's only 3 out of the 7
So pwede na.
symptoms. Pwede na siya. So that we consider the child as a presumptive TB in
Okay.
children. Then the symptoms of TB is only one of the 5 criteria for diagnosing TB in children. So very difficult in
So
children.
very difficult
So 3
kaysa
out
adult.
of 5. Yes.
So ano-ano to dapat?
One is presumptive TB, signs and symptoms of TB. The 3/7, that is weight loss. There is fever for
Body
2 weeks
weight.
duration. There is anorexia,
Appetite,
so 7, something like that. And then the other criteria is history of contacts. Then the other one is PPD or TST positive.
Positive.
And the chest X-ray and other diagnostic tests.
So kailangan tatlo doon
yes,
out
3
of 7.
5. 3 out of 7 is symptomatic. The child is presumed to be having symptoms of TB. And then 3 out of the 5 diagnostic tools is a criteria for diagnosing TB in children. Whereas in adult,
Adults.
it's simply cough of 2 weeks or more with or without the constitutional signs of TB. Wait, this
Heto kasi, tayo kasi mas common ang pulmonary TB
Yes.
kaysa Pero just to complete our discussion for our viewers, information na meron talagang TB na hindi lang sa baga, di ba?
Yes.
Nangyayari din yun.
Yes.
And do you get cases like that too? And do you record them?
Ang tawag po dyan, Doc, ay extrapulmonary TB. Yun yung EPTB natin. And we already have cases of that. In Region 10 alone, in 2014, Doc, we already recorded 218 cases in all of Region 10.
Yung 218 cases na yan, reported cases that you gathered entire, whether it's a public or a private hospital?
Yes, Doc, kasi as I mentioned earlier, meron na rin tayong mga hospitals na engaged. We actually have 6 PPMDs, that's our public-private mixed dots. Nagre-report din sa atin yan, yung Polymedic. We have Maria Reina Xavier University Hospital. We have Camp Evangelista Station Hospital. We have ISI. We have the German doctors as well.
So 218 extrapulmonary. But as per your record ngayon, let's para magising yung ating mga viewers na heto pala, it's something na hindi to be taken lightly eh. So pero sa pulmonary TB, what is our census pinaka-latest natin just for Region 10?
For pulmonary TB, Doc, for smear positive natin, we have 3,417 cases.
Marami yun.
Yes po.
As compared to the previous year, would you say na there's an increase or there's a decrease?
Actually, Doc, nag-decrease tayo with the smear positive cases. But for the smear negative, we had an increase. Kasi ngayon, mas tumas na siya. We already had 4,741 cases
na nag-subject themselves into the smear.
Yes po, yung dalawang yan, smear positive
so, medyo makikita natin, Lynn, na heto, talagang there's an improvement.
Yes.
Di po ba yung natin?
In fact, 8,000 na total.
9,000.
9,000 na
all
total
total
natin.
TBN. We have a case detection rate of 74%.
Which
Last year is only 71.
71.
So there's an increase. In other words, natitrain na talaga natin
Yes.
yung mga grassroots natin at yung mga involved dito para ma-detect nila and they can report to you. Now, when we return, we'll continue on discussing TB kasi parang heto is tip of the iceberg pa lang. There is more in TB that we have to be afraid of. It's not just, the first time cases na nadidiscover natin at ginagamot, di po ba? Please stay tuned and we'll take a very short break.
Hope Channel is sponsored by the World's Seventh-day Adventist Church. We believe in being people of the Word, people of prayer, people of deep study of the prophetic writings, people who love Jesus Christ, people who keep all the 10 Commandments, people who are compassionate, who respect others, the community, and world needs, people who live healthfully by avoiding tobacco, alcohol, unclean meats, drugs, and immorality. We believe in joy. We invite you to be a person of hope.
Aduna ka ba'y kailangan na ITB?
Doon na, dito sa Bukidnon, akong bayaw ang nakasakit og TB. Nya, mo lagi to nga ako siyang gikuhaan og sputum, tapos akong gismer amo dang gihatag dito sa mga bitik. Nya sulod sa duha man siguro to kasi mana nahibaw-an na dayon nga na siya sakit nga TB. Tapos gitawagan dayon ko niya nga kay ikaw man ang nasayon sa inyong purok, ikaw gyud ang iyang treatment partner para pagpainom sa maong tambal.
Namatay naman ganito. Matay na siya ba? Kuso kuan ba TB. Nya murag nagka-upas lang tong iyang kuan ba unya. Dugay iyang gibati ana nga TB pero kuan ba kanang adisa siya namatay pero dugay pa iyang pag-antos. Oo, niwang.
Naagyod na kuan ako nakaila sa dapit sa nawan.
Katong akong mama nag-TB. Gidalagay na ako, gipapuyo na ako di sa compound.
Unsay mabot si muna aning word nga TB nga sakit?
Delikado man guna siya nga TB kay manakod man guna. Dili ingon nga manakod sa pinaagi sa pag sa kana persaon na bitaw. Di ba maingon man nga delikado kuno kay matakod ta kung ano mga gamit sama na mga baso, mga kutsara. Pero dili man di ay na sa dala man di ay na sa hangin ang kanang kagawa na. Posible nga matakdan ka para nato nagatubang ta. Yan ako'y sakit nga TB. Tapos akong laway maditso bitaw nimo nga naghanggab ka sa hangin. Nagikan dili posible nga automatic na-TB jud ka. Matakdan jud ka ana nga kagaw.
Susugpoon gyud na kay karon nga di naman mahadlokan ang TB karon kay doon na may kuan kanang tambal sa health center. So kinahanglan moadto gyud sa health center. aron matambalan ang TB masugpuan ba nga madali ra na o mamaayo.
TB usa ka sakit nga acquired na sa tao pinagi sa sa bisyo. Sa bisyo, sa inom, sa sigarilyo.
Sa imong pagkinabuhi na murag yun nilang mas makuha nimo sa mga hugaw nga pagkaon, no? Magkaon ka sa mga restaurant nga kabalo ka mga restaurant nimo sa diha. Sa dito nimo makuha ng uban. Ang uban sa dana
Welcome back to Dynamic Living, the Total You, with our episode dealing with the mutant, TB terrible. So, we were watching kanina some of the interviewees, di ba? And we can feel na kulang pagid sila Lynn sa ilang pagkahibalo. So, atong sumpayan tong iyang gisulti nga makatakod lang, you get the disease, sabi niya na through smoking, through drinking, through mga bad vices, no? Pero it's not, di ba? You already mentioned that kanina, airborne siya. Pero paano yun? Like, people may be saying na, mo bitaw na ilahadang ihiwalay ang kutsara, ang tinidor, ang mga baso. Is that how they can also have the disease? Who would want to answer?
No, it's one of the misconceptions, Doc, especially within the community na gina-separate na to ang dishes if naatay patient sa family, within the family na meron siyang TB, talagang iniiba yung mga gamit niya. So, it's part of the stigma kasi, Doc, eh. Hindi natin ganun kadali maaalis yung stigma, especially within the community. Kaya tayo ngayon nag-a-advocate kung ano talaga yung TB at kung ano yung mga tamang impormasyon tungkol sa TB, Doc.
Yes, and that's the reason why we are here. We are here. Para alam nila na luoy man pod if you separate kasi parang you are now discriminating this person from living a normal life even within the homes, di ba? Dapat hindi siya ganun eh. So, sinabi na pag-aralan na natin kung anong-ano. Let's talk now about yung sinabi ko kanina sa iyo, Lena. Hetong Millennium Development Goal, you mentioned something na heto maganda na yung ano natin, di ba? Ang Millennium Development Goal says na by 2015 reduction dapat by 50%. So would you say na tayo with all the efforts that you are going through, are we capable of attaining that by 2015? 2015 na nga pala.
Yes,
yes, in fact, we have achieved that in 2012. Yes, there's already a 50% reduction in mortality and morbidity. That's why we belong to the 5 countries that were able to achieve the MDGs before 2015.
So, ang ganda, no? Ang galing naman. Pero, let's walk back a little while before this, sa MDG na to. When you say na heto nakokontrol na natin and all, would you say na enough na siya para maging kampante tayo? Or should we, be more vigilant than what we have already now?
Yes. In fact, Doc, meron na tayong tinatawag na active case finding. Actually, it's intensified case finding. Hindi lang, Doc, na maghihintay na lang tayo na darating yung isang presumptive TB patient sa health center or sa hospital per se. But even to the grassroots level, ang ating mga barangay health workers and CHC navigators, they are really na empowered para maghanap kung sino yung mga may presumptive TB cases.
In other words, sila na yung pumupunta house to house.
Yes.
Hindi yung naghihintay lang na lumapit sa atin, kundi tayo yung pumupunta sa kanila ngayon. So, puntahan natin, ito sinasabi natin na multiple drug resistant na mga TB. Kasi pag TB lang na simple case, lalo na kung virgin case, we call them the virgin cases, di ba? Pagkauna mong na-discover at ginamot mo siya, that's a virgin case. Pero pag sinabi natin in MDR, ano ito, Lynn?
It's a kind of TB bacilli that is resistant already to the 2 main anti-TB drugs, which is rifampicin and isoniazid. So we call them MDR-TB. If these 2 drugs are, these bacilli are resistant to these 2 main
So
drugs.
how can one have MDR? In other words, paano niya makukuha yan? Kasi syempre, di ba, magtatanong sila, paano ko malalaman? Una, how do I get it? Pangalawa, paano ko siya malalaman na meron akong ganon?
Yeah, majority of them could be due to improper medication. No,
Pag
improper dosage.
Pag sinabi mo improper medication, alam mo naman ang Pinoy, di ba?
Yeah.
Mahilig masyado yung mga over-the-counter, yung
Self-medication.
self-medication dyan, di ba? Para bang, hello, si kapitbahay ko may ganitong sakit. So, kailangan, yun din ang inumin ko kasi pareho yata kami ng sakit.
Kasi kadalasan naman do kapag nararamdaman natin na ay may ubo ako, bibili na lang ako ng antibiotic doon sa pharmacy. Kasi yun naman yung pinakamadaling paraan doon. Not knowing na hindi pala yun yung angkop na antibiotic treatment para sa kanya.
And so pagdating doon sa treatment ng TB, improper dosage o kaya naman maling combination.
Maling combination. And then, kahit ang prescription is right from the doctor, pero ang compliance sa pasyente and taking the right number, no, or the right dosage of the anti-TB drugs.
Sinabi ni Dr. Evelyn, kailangan inumin niyo po ito 3 tableta bawat umaga, ganyan. So siya ngayon naman, ang gagawin niya kasi 6 months yon. So ang pakiramdam niya after 1 month, uy magaling na ako, wala na yung ubo ko, itigil ko na nga, di ba? Isa yan. So, isa yun sa sinabi mo kanina, improper dosage. So, ano pa ang pwede at bakit siya magkakaroon ng MDR?
At saka, yun nga ang kanyang compliance. The duration of treatment for conventional TB, or we call them drug-susceptible TB, which is 6 months ang duration of treatment, at least a minimum of 6 months. But some do not finish the 6 months. That's why there in the TB program we have that we call that a strategy, DOTS strategy, where there is always a treatment partner that would supervise the patient, because in TB treatment it should be not only taking the drugs but also giving information at the same time and supervising our patients so that they will comply the exact duration of treatment as well as the exact dosage.
Yeah. So, we're encouraging our patients actually to comply, di ba? So, what's in it? Like, for example, they'll be saying na, paano kung ayaw ko na mag-comply? So, what if I have MDR? What happens? Like, anong mangyayari sa pasyente kung meron siyang MDR o kaya naman sa mga taong nasa palibot sa kanya? Mas mahirap na ba silang gamutin? Will it be more expensive?
Yeah. It's very difficult to treat for an MDR TB patient. And duration, in fact, the duration of treatment would be 18 to 24 months.
From 6 months?
From
Naging
6 months,
18 to
18 to 24 months. Plus, if the compliance is still not good with the MDR TB patients, there is a high probability that it would develop to XDR, extensively drug-resistant TB. That is already resistant to the first-line drugs, the rifampicin and INH, plus the second-line drugs that consist of an injectable aminoglycosides plus the oral fluoroquinolone.
In other words, pati yan, magiging resistant na siya.
And for the conventional treatment or for the 6-month regimen for the susceptible TB is only 6 months, and the cost would be only 5,000 to 6,000 per patient.
For the entire 6 months.
Duration, but for an MDR, it would be as much as 200,000 or more.
So, pag XDR, mas mahal pa.
Yes, mas lalo pa. And the chance of being cured is very poor.
So, yun yung gusto kong i-emphasize natin sa mga viewers natin na una, if they don't comply with it accordingly, ang mangyayari siyempre, mas magiging matagalan ang paggamutan. Ang pangalawa, pwede na hindi na sila gumaling doon. And pangatlo is, di ba, pagka naka-infect sila ng kapwa nila, mas mahirap din yung tao na na-infect nila. Yes, Jen?
Oo, kasi kung MDR-TB din yung case ng kasamahan mo, more or less likely din, yun din yung makukuha mo, Doc. Oo, kasi kayo yung magkasama
Yes, and ang ano nito is, it's difficult actually to trace, di ba? Hindi siya yung kagaya ng mga virgin cases na madali lang, you do sputum microscopy. Heto, you have to do other tests. Now, that are also very costly.
We have gene expert and culture and sensitivity na will take, for gene expert, madali lang, di ba, Doc? But for culture and sensitivity, it will take months para, para ma-check pa talaga.
So, let's talk now about, so what if I don't get myself treated from the disease? What happens to me? Yun yung tanong nila di ba? Kasi matigas nga ang ulo, ayaw nga magpagamot
Most likely, if they don't get the right treatment or they don't want to be treated, majority would die. But they die, some in 2 years, at minimum of 2 years, and some they live, and then with already
Complications.
with complications already, and as again, they're spreading already possible drug-resistant TB.
In other words,
Yes.
it should be incumbent upon each one of us to be vigilant and to be responsible.
Yes.
Di ba? So, hindi lang yung sarili mo, iisipin mo, kundi yung mga taong nakapalibot sa'yo, mga kasama mo araw-araw sa trabaho, sa jeepney,
Mga mahal mo sa
mahal mo
buhay.
sa buhay, di ba? O ang komunidad mo, di ba? Parang you're spreading. Di bali kung nagsispread ka ng pera, pero nagsispread ka ng sakit, kawawa naman, di ba?
Yeah, madali namang it
Pwede
can
namang-
be cured.
Yes.
95% there's a chance of being cured. More than 95% under the OTS, the Dutch strategy.
So pag sinabi mo,
Yeah.
Lina, heto ay may total cure ito. So in other words, it's unlike other diseases wherein you don't really get to cure it, di ba? Pero heto TB has a cure.
Yes, it can be cured and it can be prevented.
So yun yung ikinaganda sa sakit
Yes,
na to, no?
ikaganda,
Oh, so puntahan naman natin heto ngayon. So hetong programs ngayon ng Department of Health, iba hetong DOTS. Ano ito? You explain to us.
DOTS, Doc, is Directly Observed Treatment Short Course Chemotherapy. Ito yung tutok gamutan na ni-launched 1997 pa, and it has been very effective since then, Doc, kasi nga, as mentioned by Dr. Magsayo, na bumaba talaga yung incidence rate, prevalence rate, at even yung mortality rate, especially dito, specifically dito sa Pilipinas, Doc. Dahil sa DOTS, Doc, it's actually 6 months duration of treatment. You actually have a treatment partner for it. And then, every day, Doc, for 6 months, sasamahan ka ng treatment partner mo para mainom mo talaga yung gamot.
Pag sinabi mong treatment partner, sino ito?
Doc, it can be your BHW, kasi siya yung pinakamalapit sa'yo. Or if kung convenient talaga or naano ka, pwede yung mahal mo sa buhay, Doc, malapit sa'yo na pwede kang samahan, natutukan ka talaga everyday para inumin mo yung gamot.
So paano yun? Di ba libre ang gamutan nito? Di ba the Department of Health gives free medications? So ano pa? Bakit pa hindi pa natin
Correct.
magawa? Na libre na nga, andyan na nga di ba? So nakatutok na and
Grab
all.
the opportunity.
Grab the opportunity. Kasi nung araw when you get sick, I remember way back mga 1980s, when you get sick with TB, you have to buy it yourself and it's kind of expensive.
Yes.
Hindi siya yung biro na gamot. And here, this is free.
Yes, and we can assure them that we have quality drugs.
And it can be availed from all
For
walks
free.
of life.
Yes.
Even yung mga maka-afford, can they go
Yes.
to you and ask for help here?
As long as they go to our DOTS facilities.
So ano-ano itong mga DOTS facilities nyo at saan ito located?
Actually, lahat ng ating rural health units are actually DOTS facility providers po. Also, yung na-mention ko kanina, yung 6 na public-private mixed DOTS natin, they are actually DOTS providing facilities din. So, anytime may gustong mag-avail ng drugs, pwede lang silang pumunta sa pinakamalapit na health center.
Pero they need to go through an examination, right? For them to be given this.
Yes.
So doon papasok. Is chest x-ray still the main diagnostic tool here or hindi na? Nagbago
Hindi
na? Yes.
It's still the sputum microscopy.
But
So
would you require them to go through chest x-ray?
Yes. In fact, sa bagong guidelines ngayon is that we already have this classification of TB or categories. What do we call it?
Recategorization.
Recategorizing TB patients based on this clinically diagnosed TB or bacteriologic confirmed TB. So when we say bacteriologic confirmed TB, it's when we speak on the SSM, direct sputum smear
In
microscopy.
other words, pag nagbigay sila ng
Yes,
kanilang
for-
dura, examinin yun,
it's
magpa-positive
positive,
yun.
yes. Or if not, we can do the gene expert, which is available in 2 days' time.
Ah, yeah?
The result, in 2 hours.
In
It's
2
not
hours.
2 days.
Oo.
In 2 hours.
It's a matter of hours.
Yes. And then, culture.
Pero
Culture
they have
positive.
to go through a certain
Yes.
parang procedure, di ba? So, kunyari, they're complaining of cough, di ba? And then, ngayon, gusto natin na i-confirm talaga. So,
Examine
magsasabit
the
sila
sputum.
ng sputum.
Yes.
Ngayon, may chest x-ray pa yan yata, Lynn.
Yes, for the for those that cannot expectorate. So we call them, this is not done. So sputum examination not done because
hindi sila
for
makadura.
some reasons they cannot expectorate. So we go on chest x-ray.
So kung positive yung chest x-ray
positive
nila,
on chest x-ray, it's now the decision. We give the decision of the attending physician. Now
Kung
whether
gusto
this
niya.
is an active TB case or not.
Pero
So
kung
even if the smear or the examination of the sputum is negative.
Pero Lynn, pagka positive ang sputum niya, automatic active yun, di ba?
Active, yes. So we have to treat immediately because that means very infectious. So it can infect 10 to 15% as compared to smear negative or clinically diagnosed TB, which can only infect 1 or 2
So mas konti
persons per
siya.
year.
Opo. At saka po pwede kasi na x-ray negative siya,
X-ray
and yet pwede siyang x-ray negative and mag-positive siya sa sputum. Pwede din na positive siya sa sputum, negative siya sa x-ray. Pero
rin.
pwede rin sila na clinically lang na yun yung presentation. Meron ba tayong tinatawag na profile of a patient with tuberculosis? Kasi di ba, minsan na-associate natin na, uy, pag masyadong payat, di ba, parang ang tawag mo ano kaya yan siya? May TB kaya siya? Wala na ba yan?
Wala na ngayon.
So hindi na kahit na healthy, di ba?
Yes, they look healthy. In fact, especially sa people living with HIV, some would have rapid deterioration of their, what we call that, health, no? If ever they are positive for HIV and then there is undiagnosed TB. So we have to treat immediately these people living with HIV. We have to screen them. It is a protocol, standing protocol for all people living with HIV. They have to be screened for TB because in their X-ray, their findings, they do not have this, it could be negative in their X-ray, but they already have TB.
And they can be,
and they're healthy looking.
Yeah, they're healthy looking and they may not manifest anything,
Yes.
diba? And yet they're living with an HIV patient, so dapat i-treat sila.
Yes.
Pero ang tanong ko ngayon heto, isa ngayon sa problema natin yung mga HIV cases natin, karamihan sa kanila, sinasabi natin, may kaakibat na positive sa TB. Bakit kaya ganun, Lynn?
Yeah, it's because what is attacked in people living with HIV, the virus HIV, is our immune systems. We call them the lymphocytes, the T lymphocytes called CD4. So that is the one being tested once a person is diagnosed to be having HIV. CD4 agad ang ating i-check.
Nadali.
Yes. And why it's TB, prone to have TB? Because in TB, our protection, we utilize the body, the CD4. That is our protection against TB. So that is being damaged by the HIV. So,
then bigyan mo ng basilay, wala na. Mas mabilis.
Yes, mabilis because in response to the TB bacilli, our body would produce more CD4. And that is the favorite site for HIV multiplication.
Yes.
So the more CD4 cells produced by TB in response to the infection, the more sites for HIV to replicate.
So kaya
that's
mas
why there is
mapapabilis sila.
Yes,
rapid deterioration
of the immune system.
Kasi di ba nung araw, hindi natin yan na-discover. Parang nung araw, pag sinabi mong HIV, it's a chronically long disease, hindi mabilis. Pero now, parang na-notice natin, even with the WHO and CDC, na hetong HIV, when you study them, kasama na ngayon ang TB, parang there's an overlapping. Let's answer a few questions from our viewers. Ang sabi niya dito, latent TB daw ang diagnosis sa kanya. Can I get help from the DOTS, from Nene of Makabalan?
So, what we can do at the health center is, for adults, as I've said, for adults is to screen if there is risk of having HIV infection. Because if there is even risk or suspect of being an HIV, it's already a criteria for screening for TB.
Pero siguro itong kay Nene, baka ang sinasabi niya rin
latent TB siya. So there is
no symptoms, no nothing siya.
Yes, if kahit wala. We give only prophylaxis, isoniazid, according to WHO and our guidelines, only those people living
So,
with
pwede
HIV.
siyang
Kung
pumunta
hindi
sa inyo?
Pumunta pa rin siya sa
Sa
DOTS
DOTS.
facility.
Oo,
DOTS
pwede
facility.
So, Nene,
And then
dapat
I
pumunta
assess
siya.
Oh,
Yes,
dapat
para
magpunta.
ma-assist ninyo at
Yes.
ma-evaluate siya, di ba?
Yes.
So, Nene, pwede. You can get help from the
Yes.
DOTS. Ito naman, isang caller natin. We were at the hospital sa General Ward Department. There was this new patient that was admitted. After a day, the patient was transferred to a different room. We found out na TB pala ang sakit ng pasyente na yon. There were around 5 patients in the room plus mga visitors pa. The doctors and nurses didn't give us any warning. Are we infected? That happened 8 months ago. I have a cough now. Should I go for a checkup?
It could be,
Uh-huh.
but it could not, that patient, we call that part of contact tracing. If belonging to the same family, household, no? Or a contact of a family member of that patient. Kung guest ka lang, kung it depends upon the number of hours that you were there.
And
Kasi-
also, you
Yes.
have to consider also your immune status.
Yes, your immune
Usually,
status.
di ba?
Yes.
Usually, kapag ka healthy and well ka naman, wala namang mangyayari sa'yo because your body can fight off the bacilli. It's when your systems are down, that's when you start maybe having the disease.
Yes.
Di po ba?
I
So,
consider sad ang load, bacillary load of the patient. Kung
Yes.
severely ill ba, no? And then the patient is really a pulmonary TB, and then positive. So as I've said, greater ang risk.
Pero
So,
pwede rin
kung
siyang
8
pumunta
months
sa
ago,
inyo.
pumunta pa rin for workup, for
Gusto niyang
screening.
i-make sure, Doc, pwede naman siya magpa-screen.
Magpa-screen, di ba? Pwede pa rin pumunta sa inyo.
Yes, we do not refuse patients. In the DOTS facilities,
Yes.
all are welcome.
Okay, galing, no?
Ang
So, yung
galing.
DOTS facility
Yes.
natin is open 8 to 5, Monday
Yes.
to Friday.
Yes.
And it is manned fully talaga. In
Yes.
other words, may tao talaga doon mag-aasikaso sa kanila.
Yes.
So, ang tanong ko ay, yung sinasabi nyo kaninang treatment partners, heto ba, ibibigay nyo ba ang entire 6 months na medication doon sa pasyente para sa kanyang or you give that on a weekly basis, on a monthly basis para bumalik sila at ma-follow up natin? How do you go through with the giving of the medication?
Actually, Doc, allocated na yung ating once you are positive for TB and you are diagnosed, ang mangyayari, bibigyan ka talaga ng set ng drugs for you to take for the whole 6 months duration. And your treatment partner will ensure na talagang maiinom mo yun everyday. So, kung malapit ka lang sa health center, depende kasi yun sa convenience din at saka availability ng client, especially if working siya, kung ano man, may iba't ibang strategy na ginagamit yung ating mga respective health centers, Doc. Kung ano ba, like weekly basis ba, or monthly basis ba, or kung yung barangay health worker natin yung mas lalapit pa dun sa sa patient.
So let's
Pick up
go.
of drugs.
So pick up of drugs. So
Yes.
ginagawa din 'yon.
Yes.
And then sinabi ninyo na even the MHOs and the RHUs are empowered already.
Yes.
So let's talk about now hetong protection. How can we protect ourselves from this? Do we ordinarily take in INH, isoniazid, in order as a prophylaxis para lang sigurado ako na sa aking paglalakad diyan kung saan ako nakakarating hindi talaga ako mahawa?
Okay. The best protection is prevention. That's it. So we call that a infection control. So TB infection control should be implemented in all facilities. So it's not only at home, but also in all facilities. So the best prevention is kung apply it, no, the prevention. Number one is the use of early detection. No? So early detection of those with those who are having symptoms of TB or presumptive TB. Early detection, because if there is early detection, there would be early institution of treatment. So within 24 hours, in fact, the latest study
Yes,
now is
24 hours.
with our current treatment regimen, even within 24 hours with the right regimen and the right dosage, the bacilli population in a person having TB would be markedly reduced
In
by
other
more
words,
than 70%
Wow.
or 85%.
So 24 hours.
Yes,
In other-
24 hours.
in other words,
that
Lynn,
would mean reduction of transmission.
Yes. In other words, you reduce your being
Yes.
infective, di ba,
Yes.
Jen?
Yung atin dati kasi it's 2 weeks, but with the recent studies conducted now, 24 hours lang, Doc. Pag tinake mo yung meds talaga religiously, hindi ka na infective nun.
And yun yung mahalaga na
Yes.
iparating natin sa ating mga
Yes.
viewers. Kasi ibig sabihin nun, it is really upon themselves to be vigilant
Yes.
para hindi nila mahawa yung mga
Yes.
tao sa palibot nila.
Yeah.
Diba? Pero like for example, you're already under treatment. So, kunyari, under treatment ka na, diba, mga pre-employment na yan, may chest x-ray na nire-request. Papaano yun? Would they be able to see that as yet kung positive ka to start with doon sa chest x-ray?
Okay, so as a TB infection control, all our health workers, no, kung DOTS facility siya, they should have this part of their infection control policy is of screening of TB. So on X-ray. So every 6 months, depending the burden of TB in their facility. So kung medyo marami, more than every day there are really TB cases, more than 5. So it's already quite, no?
Marami.
Na yan. So they have to be screened, no? Annually or twice a year for X-ray. And then if there are some changes, so it should be a comparison. That's part of the infection control plan. And then at first also we encourage TST for adults, tuberculous skin testing or PPD in adult healthcare providers. But only once positive, we stop now the screening.
In other words, kung
Yes,
mag-positive siya, ibig sabihin,
pag-positive siya.
pagamutin na siya.
Pag mag-positive siya, just for surveillance purposes.
For surveillance lang.
Yes.
Kasi nung araw, ang tinituberculin natin mga kabataan
Yes.
lang, di ba? So
Yes.
ngayon, meron na rin for adults siya.
But if they are negative at first, then we give possible surveillance pa rin. Then once there is conversion, that would be another thing. No? So we have to assess, since it's adult, we have to assess whether this is only be a latent TB or an active TB.
Is it true, di ba? Parang, we know for a fact that the Philippines being endemic man talaga tayo,
Yeah,
di ba? Ibig
that's why.
sabihin, kahit na tayo, we may have it, di ba?
Yes.
But the thing there is, yun na nga sinasabi natin, it may be there, the bacilli may be there inside us, and yet, hindi siya mag-a-activate, hindi ka maging infectious or contagious if you take good care of your health, di ba?
Yes. So there is no disease manifestation,
Yes.
only the infection. We have the infection, but it is well contained. That does not produce into a disease. So there is no need to treat. So that's in adult, because being a high burden country, there is no justification to treat or
Yes.
to give IPT with only one drug
That's
in a
true.
high burden country.
Yes. At saka di ba, hindi mo naman talaga din alam
Yes.
kung meron ka o wala,
Yes.
di ba? Unless you manifest it, di ba? So may tanong tayo dito from one caller. Sabi niya, may special privilege ba ang mga TB patients sa PhilHealth? Do you have a special program na relationship with PhilHealth regarding TB cases?
Okay, we have this PhilHealth OPD DOTS package, but this DOTS package is for to be given to the facility, to the DOTS facility. There is a package of 4,000 that will be given back to the DOTS facility, because for our patients we already give
The
the medicines,
for free.
even the diagnosis for free.
So,
the DSSM is for free, and the
everything is
follow-up,
free.
everything is
Yes.
free.
So kumbaga, there is no
Yes.
reason at all why we
Yeah.
should not avail of it.
Yes.
Di ba?
So for the OPD package, that is given back to the facility.
Okay.
the
Ang tanong ko
provider.
naman hato ba ngayon, Jen, hato sa DOTS natin, yung ating mga caregiver providers, from the medtechs down to the midwives, to the nurses and the doctors, they're really trained and updated by you.
Yes po. Actually, just last year, we completed 12 batches of training for doctors, nurses, and medtechs for the revised NTP Manual of Procedures. Yun yung updated na guidelines talaga natin on how to treat, counsel, and diagnose TB
You also do
cases.
counseling to patients?
Yes po.
Aha, so
Important.
kasama yan. So hindi lang tayo sa HIV nagka-counsel, even with those with TB.
Yes. Tapos, for the midwives, we have 27 batches na training din sa kanila. Much shorter lang, pero para ma-equip din talaga sila sa ating new Manual of Procedures. And our barangay health workers and CHT navigators, they had actually 33 batches.
Ang galing,
All over
no?
Region
All
10
over
po
Region
yan.
10.
Yes.
So makikita natin na you're really on top of the situation, you're doing everything so that these people can be empowered. Kasi naalala ko nung araw, ang hirap kaya hanapin ng basilay.
Correct.
Hindi kaya lahat yan magpa-positive. Di ba, Lynn? I mean, years ago, it's so difficult. Kaya karamihan yan, pag may nagre-request yan, negative lahat, di ba? Pero ngayon, nagkakaroon na tayo ng magandang yield. So it really helps in the way we contain the disease.
We empower also the community. So that's why we call that, there is now a project ongoing, especially on drug-resistant TB, PMDT. One of these is being introduced, and a recommendation of WHO is a community-based care, ComCare. That's the latest. So community-based, meaning it's already at home. No, there will be some projects now, if this would be effective, because we are empowering the communities to detect more TB cases, and then just like the GIDA, they are far distant. Their access to the facility is quite difficult. So we introduce the dots at the community in their homes, really. But this is an ongoing project.
No, and we will
for
be able
early
to see,
detection
and we'll be
and
able
early
to see
treatment.
kung how effective
Yes, how
that will
effective
be.
this
No,
will be.
napakabilis po ng oras ko dito sa Dynamic Living the Total You. Napakaganda na aming discussion on TB. Mutant na nga ito, and parang mutant ninja. I'd like to thank my guests. Dr. Evelyn, what would you like to tell our viewers?
Okay, thank you very much, Jane, for this opportunity. So the Department of Health Regional Office 10, though rocks now, we really appreciate your invitation, because we can, in this way, we could increase the awareness of our population to really go and not be ashamed to go to our DOTS facilities, because they can be helped really. And also in that way, we will be helping each other, no, reducing the burden of TB in our people, in our community, and as well as in our country. So post-millennium, post-MDG, we are now looking on post-MDG goals, because we have already achieved it. So on sustaining the gains, and then hopefully there will be no more TB na, in
Yes,
the
so
nearest
kung
future.
baga ano tayo, TB eradication na
Yes.
susunod natin. Yes, Jen, what will you tell our viewers?
So, first of all, Doc, thank you so much for having us in your show tonight. So, on behalf of the Department of Health Regional Office 10, we would like to thank you. And this time, thank you for the opportunity, because this is part of the advocacy of the Department of Health, of course, para tuldukan natin yung TB, especially dito sa Pilipinas. Kasi nga, yun yung tagline natin eh, TB ay tuldukan. So, sa mga nanonood ho ngayon, maging vigilant ho tayo. At kung 2 linggong ubo ho, pumunta ho tayo sa pinakamalapit na health center. Lahat ho ng health center dito sa Region 10 ay equip po sa ating DOTS. Kaya wag ho tayong mahiya, wag ho natin ikahiya yung ating, kung meron man tayong TB, kasi meron hong gamot dito. Libre ho ang gamot. Kaya pumunta lang ho kayo sa pinakamalapit na health center. Tsaka idadagdag lang ho namin, Doc, World TB Day celebration ho on March 24. Kaya nagka-celebrate po hindi lang yung Pilipinas, kundi po ang buong mundo. With the theme po, Stop TB, hanapin, gamutin, pagalingin.
Okay, napakaganda po. Tuldukan. In other words, put a stop to it. Remember that tuberculosis is a disease that can be prevented, and each one of us can be protected. It is our responsibility, joining hands in hand with the government facilities as well as the private enterprise and our families too, and the community, to help each other, put a stop to this disease. Magandang gabi po sa ating lahat. Ay, sa kindo. Oh, see? Bilis na kayo sa oras.